May wrapped up the end of Women's Health Month. As it comes to a close, Baton Rouge General Hospital wants women to prioritize screenings and preventative health care. Make sure you take a look. So this is the last month of Women's Health Awareness Month. Are there any particular illnesses that affect women in Louisiana?
Yeah, we do. So in Louisiana, we have a very diverse population. And actually here in East Baton Rouge Parish, we have the second highest rates in the state for breast cancer. And so when we look at breast cancer, usually it's identified on an annual mammogram. What we see here even in East Baton Rouge Parish, but nationally, is that amongst women who get diagnosed with breast cancer, Black women tend to have a higher mortality rate. We're not sure if that's necessarily because maybe they're finding their cancers later, maybe their cancers are more aggressive, or maybe is it because there are systemic issues in healthcare. So that's one trend that we know of that's affecting us locally and that we also see on a national scale.
Wow, anything else? I mean, what about HPV? That's something that affects a lot of women nationwide.
Yeah, so the Gardasil vaccine has been around for maybe over 12 years now, but it is still we're still having a hard take rate. Fortunately, the Gardasil vaccine has been approved for women into their 40s now, and so that could be a way we reduce cervical cancer further. But yeah, so interestingly, cervical cancer here in Louisiana is actually more common than it is in many other states. And so definitely, if we could talk to patients about getting the Gardasil vaccine, many patients that were too old to get it when they were kids because it didn't come out then, could now get it as adults, and they could see reduction in their risk of cervical cancer, potentially throat cancer, and anal cancer even.
And you said that cervical cancer is high here in Louisiana. Is that because of HPV?
It is because of HPV, yeah. And so we know that there's high-risk strains of HPV that are related to cervical cancer, and the ones we have here in Louisiana we think that we have some that are kind of more specific to our area here, which is kind of interesting.
Okay, well, outside of cancer and HPV, are there other chronic illnesses that affect women in Louisiana more than other places?
There are. So here in Louisiana, with the diversity of the population, we have good food, we do a lot of partying down here, so we have a really high rate of chronic conditions, things like diabetes, obesity. We have a lot of smokers that still have significant risk factors to their health. We have quite a few patients that have chronic hypertension. We see a high rate of kidney disease. And so these kind of chronic conditions are ideally treated with a primary care model. And so unfortunately, I think one barrier to care in Louisiana is just that a lot of patients don't have a primary care doctor. And so when they find out about these problems, maybe things are a little more advanced or a little more far along than when they could have found out, years before.
Right, so it's all about preventative care, really.
Yeah. So I think ideally, all Louisianans should have a primary care doctor, someone who knows their health history, someone that they can call when they're sick. I think we're all using the urgent cares all the time when we feel bad, but really kind of like having a primary care home to manage your chronic conditions that you may not even know about is sort of the most important thing women can do at any age of their life.
All right, so everything seems to go back to preventative care. So that means get your screenings, go and get your shots, and just make sure that everything's okay. Go to those doctor's appointments.
Yeah, and what I'll say about that is I think patients, when they think about the gynecologist, they think, oh, well, that's just my pap smear. But it's so much more than that. Ideally, when you go to your GYN, you're going to be talking about wellness. You're going to be talking about your exercise habits, what you eat. You're going to be talking about how is your sex. You're going to be talking about how are your bowels working. You know what I mean? What does your breast health look like? And so really it's the whole picture. And so, I think trying to reframe it as instead of just, I need my pap smear, it's how well am I?
Wellness check.
Am I up to date on all the screenings that I need? One quick thing, colonoscopies used to be a screening age 50, and now we're seeing that patients really could benefit from a colonoscopy starting at age 45. So that's something that we've adjusted just in the last couple years. And then the other thing is a lot of patients are skipping out on their mammograms. And so getting a mammogram every year after the age of 40 even if you don't have a primary care doctor, even if you don't have a gynecologist, try to find somewhere to get a mammogram.
All right, so
Yeah.
preventative care, that's what everything comes down
Yeah,
to.
yeah, I think so.
All right, well, thank you so much for talking with us.
Thank you.